Most people think of vitamin C as something you take for your immune system or when you have a cold, but in high dosages under medical supervision, it can play a vital, powerful role for supporting the body during integrative cancer care. Hi, I'm Dr. Gez Agolli, and today we're diving into how high-dose vitamin C works, what the research shows, and how it can help the body restore balance and resilience. When used in the right way, high-dose vitamin C helps strengthen the body's defenses and improves how your cells function. That's what functional medicine is all about. Vitamin C works differently when given intravenously because it bypasses the digestive tract. It goes right into the cell. Vitamin C is a very powerful free radical scavenger. It can also help with the cell-to-cell communication, and it works on several different pathways and mechanisms. And we use it at Progressive Medical adjunctively when patients are going through different integrative oncology treatments. And there's been a plethora of research to show that high-dose vitamin C is a pro-oxidant. High-dose vitamin C, anywhere from 25 grams and above, is pro-oxidant. It's not an antioxidant. And this will actually help rebuild the immune system. It helps by adding oxidation into the cells, and cancer cells do not like oxidation and they do not flourish in that environment. So our philosophy is to treat integrative cancer patients from a holistic perspective, and using high-dose vitamin C is one of those therapies that will help accomplish that goal. There's a lot of confusion when it comes to chemotherapy. Chemotherapy is a very powerful medication that actually helps destroy cancer cells. Also, it affects the other cells, the normal cells. So integrative practitioners believe in supporting the body's immune system and the body's detoxification pathway. And taking antioxidants away from chemo could be a strategy. And this is something that you should be talking with your oncologist about. They prefer not to have any antioxidants whatsoever, but if you take a look at the chemo mechanism of action and the half-life, how long the chemo stays in the body, this is something that you could use to support. At Progressive Medical, our integrative practitioners use high-dose vitamin C, which is a pro-oxidant. It is not an antioxidant, so it can work synergistically with your traditional chemotherapy treatments. University of Iowa did publish a study that shows when you utilize high dose anywhere past 25 grams, typically integrative practitioners use up to 50, 75, or even up to 100 grams of high dose vitamin C, and that is a very powerful pro-oxidant, and that will help bring the body into something called apoptosis, which is a natural cell death of those cancer cells. So clearly there is a misnomer and misinformation when it comes to vitamin C. You have to differentiate the dosages because there's no way anybody can tolerate these high dosages taken orally. Also, using intravenous, any type of intravenous therapy when you're battling cancer, you're going to bypass that digestive tract, get it right into the bloodstream, and help your body heal from the inside out. A typical high-dose vitamin C IV session at Progressive Medical involves a registered nurse and her team taking your vital signs, bringing you into a very comfortable environment, accessing your vein, or whether you have a port or not, they will access it in a very comfortable environment. And it's a very slow, between 3 to 4 hours. We want to get that IV in slowly into your body, and you're in a very good room with other patients as well. We do have stacking therapies. We do believe in something called PEMF, which is a pulse electromagnetic frequency, and that's also going to help not only relax the body, but bring in cellular oxidation into the cells and helps that cell-to-cell communication. We're also a big believer in hydrogen inhalation, so you'll be breathing hydrogen for at least 30 minutes. There's a lot of research with hydrogen. Hydrogen involves special gases. Over 9.5% of your body is made of hydrogen, and there's research that talks about how it resets the mitochondria. And we also know that one of the areas of dealing with any type of chronic disease, specifically cancer, there's a breakdown in the cells, and these cells just continually to replicate out of control, and that's what's the beginning stages of cancer called neoplasia. And we believe that the mitochondria is disrupted and cancer cells can hijack the mitochondria, so we're looking for strategies such as hydrogen as well as that. Yeah, when it comes to high-dose vitamin C, many cancer patients will benefit from that, and we found that when you actually begin these therapies sooner rather than later, if you're doing chemotherapy or radiation, it just helps the body recover quicker. It can disrupt the cancer cells and assist the body to bring these cancer cells into something called apoptosis, which is natural cellular death. So we believe it's a great strategy to use high-dose vitamin C depending on your treatment protocol with your conventional oncologist or your integrative practitioner. At Progressive Medical, we have seen great results with all types of cancer. Cancer's on the rise. According to statistics from CDC, NIH, well over 2 million Americans will be diagnosed with cancer. And we believe that you need to educate yourself because knowledge is power. And this is just another great strategy to help you get well and to continue the fight with cancer. At Progressive Medical, we take your safety very seriously. Our licensed practitioners will evaluate you from a very thorough history and physical, and to make sure that you're a candidate for any IV therapy whatsoever, make sure you have good access and you're explained the benefits and risks. One of the major benefits of high-dose vitamin C is to oxidate that body and to help the body get into a healing mechanism we call homeostasis. But the biggest concern with high-dose vitamin C is that it's a pro-oxidant, and you need to have a test performed called G6PD, and that G6PD is a very, very specific enzyme, and if it's too low, then you're not a candidate, and your licensed practitioner will talk to you about other options. So we take it very seriously, and no one at Progressive Medical will have any IVs performed until we do a thorough history and we do a blood test, CBC, CMP, and more importantly, the G6PD. If you're out there watching this and decide to go to another facility out of state or wherever, always make sure you ask for a G6PD before they do high-dose vitamin C. Yeah, it's very important to address the terrain of the body, because we want to make sure that the body is in a healing mechanism, that any pathogens are cleared, that you have a very good detoxification pathway, and your lymphatic system is working effectively. Because we believe one of the mechanisms of cancer advancing in our country today in 2025 and ahead is that we live in a very toxic environment, and your body is like a sponge, and that sponge accumulates toxicity. So we want to make sure what's going on. Do you have infections? Do you have potential body burden of heavy metal toxicity, environmental? So we're looking how to help that terrain to be cleared. We use lymphatic drainage, we use hydrogen strategies, we use infrared saunas to gently detoxify the body. We use ozone saunas to oxygenate the body. So we want that terrain to be in the most optimal environment so you can continue to heal and get momentum, because what you really need to heal with cancer, whether you're using traditional therapies, integrative, or natural therapies, is you need momentum to continue that healing moving forward. And at Progressive Medical, we believe in treating the body from head to toe, and that starts with looking at your microbiome and your terrain. Yeah, the benefits of high-dose vitamin C is that there is an increase of energy, but our goal is not only energy, which is obviously a great side effect because it's better than feeling down and feeling ill, but really getting into the cell, you're going to have more energy, more clarity, vitality, and really also knowing that you're doing everything possible to help your body win this battle. And I think that's also very, very important, that you actually have this hope as well. And we bring the science into it because the science really has shown that high-dose vitamin C plays a role. It's not a panacea. It's not a standalone treatment as well. It's just part of your wellness package and program to continue this fight with cancer. If you're newly diagnosed with cancer, that's a devastating diagnosis to have. We've seen this time and time again at Progressive Medical for the past 27 plus years, and we're very sensitive and compassionate to that. We're not immune to any sick patient with chronic disease. We consider cancer a serious disease, but it's a chronic disease. It's really caused by multifactorial problems. It's an advanced chronic disease. And what we like to give is realistic hope. We want you to seek all of your options. Traditional medicine offers some great options as well, but when you pair that together with functional integrative medicine, it's a winning strategy. And we want you to have hope. There's been many, many patients that have gone through the same journey you're about to take. And obviously there's a lot of information out there, and it's easy to get into the paralysis of analysis. My message is a message of hope, to find a team that you're comfortable with, to find a group of like-minded practitioners that are going to encourage you and be alongside you, coaching you to victory. And that's really the key, because you control this opportunity and to make wise decisions as you navigate through the maze of dealing with this illness. So having hope is very important. If you want to learn more about how we approach healing from the inside out, hit that button, subscribe, and turn on notifications so you never miss a new video. I'm Dr. Gez Agolli with Progressive Medical Center, and this is your life. Live it well.